All right, let's dive in. Today, we're going on a guided journey through the world of infertility treatment. We're going to break down the science, the steps, and the incredible options that exist today. So, let's get right to it.
You know, for millions of people, this question isn't just a what if. It's a deeply personal reality. It's the start of a journey that can be complex, emotional, and really challenging.
And it is way more common than most of us realize. We're talking about roughly 10 to 15% of couples of reproductive age who are facing infertility. That makes it a major health issue affecting people all over the world.
So, what are we actually talking about here? What's the clinical definition? Well, for most couples, it means they haven't been able to conceive after a year of trying. Now, that timeline gets a bit shorter, down to 6 months, if the woman is over 35, simply because age plays such a big role in fertility.
Okay, so let's start with a really important point. For a very long time, infertility was kind of seen as just a woman's issue. But the science is crystal clear on this. Male and female factors contribute pretty much equally when a couple is having trouble conceiving.
So, where does this whole journey typically begin? You might be surprised to learn that it's often not with super high-tech procedures. Actually, the first steps usually involve building a really strong foundation for your health, focusing on the things you can actually control.
The whole idea is that your body's reproductive system doesn't just operate in a bubble. Before you even think about more complex stuff, the focus is on optimizing your overall well-being. And honestly, that can have a huge, profound impact on fertility.
These right here are the big pillars. Things like your weight, how much you exercise, what you eat, and how you manage stress, they aren't just for your general health. They directly mess with the delicate hormonal dance that's required for conception. That makes them powerful first-line therapies.
And weight is a perfect example of this. It's such a delicate balancing act. See, being underweight can actually cause the brain to stop sending the right signals to the ovaries, pretty much shutting down ovulation. On the flip side, being overweight is often tied to insulin resistance, which can really mess with ovarian function, especially for women with polycystic ovarian syndrome, or PCOS.
But the good news is that small changes can have a dramatic impact. I mean, check this out. For a lot of women with PCOS, losing just 5 to 10% of their body weight, which is totally achievable, can be enough to kickstart ovulation again and restore their fertility. That's pretty amazing.
Okay, but what if those lifestyle changes aren't quite enough? Or what happens when a doctor pinpoints a very specific problem? Well, that's when the journey moves into its next phase, targeted medical treatments.
The whole strategy here shifts to direct correction. This stage is all about finding that one specific problem, whether it's hormonal or physical, and then using a very specific medical or even surgical solution to fix it.
So a really common first step for women who aren't ovulating regularly is something called ovulation induction. The process is pretty straightforward. First, you get the diagnosis confirmed. Then you use a medication like clomiphene citrate, which basically tricks the brain into sending a stronger signal to the ovaries. And finally, everything is monitored to make sure, yep, an egg was released.
But what if it's not a hormone issue at all? Sometimes, the path for the sperm to meet the egg, or for an embryo to implant itself, is literally blocked by a physical barrier. Yeah, we're talking about actual physical roadblocks here. Things like blocked fallopian tubes, or uterine fibroids, or even scar tissue from a condition like endometriosis. They can physically get in the way of conception. The good news is that in many cases, surgery can fix these issues and clear the path.
All right, so what happens when those targeted fixes aren't the right option? Or maybe they just haven't worked? This is where the journey can take a big leap into the highly advanced world of assisted reproductive technology.
So what exactly is assisted reproductive technology, or ART? Well, the key difference, the thing that separates it from everything else, is that these are procedures where both the eggs and the sperm are handled outside the body. That one step, retrieving an egg from the ovary to be worked with in a lab, that's the game changer.
Now, the most famous ART procedure, of course, is in vitro fertilization, or IVF. Let's just break it down real quick. It starts with medications to help the ovaries produce a bunch of mature eggs at once. Then those eggs are collected in a pretty minor procedure. Next up, in the lab, they're combined with sperm to create embryos. And finally, a healthy embryo is carefully transferred back into the uterus.
And IVF isn't a one-size-fits-all deal. It can be customized. For example, if there's a serious issue with male factor infertility, there's this incredible technique called ICSI. It's where an embryologist takes a single, healthy sperm and injects it directly into the egg. It's an amazing way to overcome a lot of fertilization barriers. And the world of RT just keeps opening up new possibilities. For women who might not have enough of their own eggs, or for genetic reasons, egg donation is a path forward. And for those who can't carry a pregnancy themselves because of uterine issues, a gestational carrier can make parenthood a reality.
So we've covered the main paths, but it's really important to take a step back and look at the whole picture. This journey is hardly ever simple, and it absolutely comes with its own set of challenges and risks.
And these challenges are very real. On the medical side, you've got risks like having twins or even triplets and a complication called ovarian hyperstimulation syndrome. And beyond the physical, you just can't ignore the immense emotional stress and, let's be honest, the huge financial burden that often comes with all of this. I mean, look at this. It's pretty startling. As the early fertility treatments got more and more common, the rate of triplets and other high-order multiple births just exploded. It went up by over 400% in less than 20 years. And that, of course, brought on some serious health risks for both moms and babies.
But here's the crucial thing. The medical community saw this happening and responded. To make the whole process safer, modern guidelines now put a huge emphasis on something called elective single embryo transfer, or ESET. By transferring just one healthy embryo at a time, the risk of a high-risk multiple pregnancy is cut way down. It's all about prioritizing a healthy outcome.
All of this incredible progress leads us to one last big question. The science is just constantly pushing forward, blurring the lines of what's even possible. So, as we look ahead, the real challenge becomes, how do we keep navigating these powerful new technologies ethically and effectively to help build the families of tomorrow?